Hi everyone, my name is Maria Pamela Tanwanko, and this is my presentation on evaluating a global health issue, prevalence of diabetes in Mexico. The objectives are specify the statistics of diabetes in Mexico, identify the risk factors of diabetes, describe potential gaps in the data, establish social or economic opportunities to reduce diabetes in Mexico, and recognize the points of interest. The evidence and statistics. Using the Institute for Health Metrics and Evaluation, the primary cause of DALYs or disability adjusted life years in Mexico for both male and female was diabetes for 2019. The number of deaths in 2019 because of diabetes was almost 85,000, and DALYs were almost 3.5 million people. 1 in 6 adults are living with diabetes in Mexico, according to the International Diabetes Federation, and almost half of the people living with the disease are undiagnosed. As seen in the table above, from the Institute for Health Metrics and Evaluation, the top cause of death and disability in Mexico is diabetes. There are various major risk factors related to diabetes, and there are 2 types of diabetes. Type 1, it usually appears in adolescence, it develops rapidly, and it is when the pancreas does not produce enough insulin or not enough insulin. In type 2, the body is resistant to insulin, and it develops slowly, usually diagnosed when older. Although the risk factors for type 1 are not as clear, type 2 diabetes is preventable and have clearer risk factors. Older age are more prone to diabetes. Lower levels of education are significantly associated with a higher risk of diabetes. And there are high percentages of overweight and obesity in Mexico, which is a major risk factor for diabetes. Smoking is also a major risk factor of diabetes because currently there are 15 million active smokers in Mexico, which can also cause diabetes as chemicals in cigarettes can assist in making cells stop responding to insulin. Potential gaps or limitations in the data. Some limitations in the data are the lack of diabetes registry. The prevalence of diabetes has been obtained from diverse national surveys in Mexico. However, it does not show an accurate representation of the amount of people affected by diabetes. Because of this, there are more people that have diabetes that are not part of the data. There is also a limited information on the incidence of diabetes in Mexico. There are not enough studies that have examined the incidence between males and females, therefore some information may have been missed. Lastly, the lack of available treatment in the healthcare system of Mexico has contributed to some gaps in the reporting of diabetes. Some population groups do not have financial security to regularly receive medical care. Because of this, many are left undiagnosed, leaving a possible underestimation of the disease. Social or economic opportunities to control/reduce the prevalence of diabetes in Mexico. Reducing sugar consumption. According to a report in 2015, Mexico was considered the leading consumer of soda. They consume more than 600 8-ounce serving per person per year. Consuming large amounts of sugar can increase the risk of obesity, which can lead to diabetes. This is also related to Goal 12 of the Sustainable Development Goals, which is responsible consumption and production, as the production process of soft drinks or soda uses vast amounts of energy, causing soil erosion and degradation, and releases large amounts of chemicals into the environment. Therefore, increasing the tax on sugar-filled beverages can control and reduce the prevalence of diabetes in Mexico. Also, promoting physical activity in public health spaces can combat lifestyles that is linked to diabetes. There are limited parks available in the cities of Mexico, and they are crowded with street vendors or the sidewalks are broken, which discourages the community to go outside. Because of this, it is critical for the government and health officials to address these issues and create healthier public spaces for the community to go out and exercise. Lastly, the government officials and public health professionals should offer free regular HbA1c and diabetes checkups. This can ensure that the community can have access to the care that they need and to reduce the prevalence of undiagnosed diabetes in communities. The main points of interest in analyzing this health issue is that it is the leading cause of death in Mexico, and it is affecting 14 million adults, as reported by the International Diabetes Federation in 2021. Because of this, the diabetes health-related expenditure in Mexico has cost 20 billion US dollars. Majority of the population affected by diabetes is type 2 diabetes. This is the most preventable with proper access to healthcare, eating healthier, and being more physically active. Overall, implementing diabetes prevention programs and addressing the risk factors that increases the risk of diabetes is detrimental to decrease the mortality and morbidity of diabetes in Mexico. Diabetes, specifically type 2, is highly preventable and it starts by changing in lifestyle habits. Please let me know if you have any questions. These are my references. Thank you.